This research started out more for, or in a kind of a response, even though it's been known for decades now, about this non-enzymatic methylation of DNA. Our group in the last couple of years has looked into this non-enzymatic methylation mechanism in folic acid and also in non-enzymatic methylation of RNA. So it's stimulated kind of renewed interest in methylation of DNA. And it's always, it's always there in the background with epigenetics. But specifically with the intracellular methylator S-adenosylmethionine, they have known really since the early 1980s that it will non-enzymatically methylate cytidine in DNA. Another non-enzymatic methylation by methylcobalamin also takes place. And specifically in the case of cytidine, it will methylate it to what's sometimes considered to be the fifth base pair in DNA, or the fifth nucleotide, 5-methylcytidine. And if left alone, it will spontaneously deaminate. Okay, it will lose its amino group and really become the nucleotide thymidine. So we're really getting, this cytidine to thymidine point mutation. And it's been implicated, as I said, it's been known about since really the early and mid 1980s. And since then, it's been implicated in some of these point mutagenic cancers. But overall, cancers in general display a global hypomethylation. Okay, an undermethylation of their DNA. And so it's what we looked into was the possibility, of an inexpensive over-the-counter supplement such as S-adenosylmethionine, known as SAMe over-the-counter, as well as the methylcobalamin precursor cyanocobalamin, vitamin B12, and thought it may possibly play a role as a potential adjunct therapy in certain cancer treatments. We picked cancers treated with alkylating chemo agents because that tends to do the most damage if it were to DNA, and it can be thought of much in the same way that folic acid is used as a rescue therapy when using anti-folate chemotherapeutic agents. And as I said, interest has kind of been accumulating over the last couple of years. We finally got some clinical trials set up at the end of 2019, and the pandemic hit, so they've been kind of shelved kind of indefinitely here. And so I was hoping to present some good results from those trials. Unfortunately, that'll have to wait, but we were able to at least do a case study, okay, on a patient who was willing, and we of course with the cooperation of in my local health system, Valley Health System, and Shenandoah Oncology, and we're able to do a case study on a patient who was undergoing this protocol. But first I want to mention about these methylating agents. And the reason I focus on SAMe, the S-adenosylmethionine, it's pretty much the primary methylator in all living organisms, right? And as well as viruses. So as I said, it's the primary one, with cobalamin B12 and folate or folic acid being kind of secondary and tertiary methylating agents. So that's why we focused on the S-adenosylmethionine. And all of these methylating agents are involved in DNA and RNA synthesis. They can all potentially address this hypomethylation we see in various cancers. And they're even all antiviral in their nature, usually through gene silencing, okay, that transition over to that 5-methylcytosine that I mentioned. but unfortunately, they can also be involved in activation of genes as well. So it can be a little tricky. It's still trying to get sorted out, you know, when gene silencing is involved and when gene activation is involved. And therefore, you know, that to us, that looked like another call for, you know, clinical trials, or at least in this case, the case study, to follow patients and see, well, does this, you know, help in cancers? You know, will it would help improve outcomes and attenuate side effects, or will it actually do more harm than good? Fortunately, as we'll see with the outcomes, it actually is working out for the better. But something else that occurred to us, that with this, you know, antiviral activity of methylating agents is possible anti-SARS-CoV-2 activity, right, against virus causing COVID-19. So studies may be warranted there. And this antiviral activity may actually complement the anti-cancer mechanism, okay, that we're seeing. You know, they not only addressing the hypomethylation in the cancer cells, but also in viruses, some of the viruses that cause this, that have been linked to the progression of various cancers. And as I said, in this case study, and you know, we were going to focus on in the clinical study CLL, right, chronic lymphocytic leukemia, which we know human T-cell lymphotrophic virus type 1, HTLV1, as well as Epstein-Barr virus, right, EBV, have both been implicated in the progression, okay, of CLL. And even though the incidence is kind of low, as I said, you know, this may still play a role somehow in its mechanism of action that, again, you know, we're going to look into further once these trials resume. But as far as the case study itself, we like to call it the Kowiatek protocol, and we looked at a 52-year-old Caucasian female who was diagnosed with CLL, and she was administered radiation therapy plus chemotherapy, okay, RTC, excuse me, and the chemo agents were an alkylating agent, okay, bendamustine, the brand name Treanda, and rituximab, okay, brand name Rituxan, that's a monoclonal antibody. And she was also administered packed red blood cells. And then we started the protocol at the same time with administering 400 milligrams of S-adenosylmethionine daily, right, immediately post-chemo. And what we saw was that she ended up tolerating the radiation and the chemo, okay, extremely well, with minimal side effects. It's usually, you know, alopecia is usually expected, and you know, she initially showed negative for alopecia, and she was experiencing some nausea and vomiting, but again, even that seemed, you know, more minimal than the nausea and vomiting usually involved with the use of these chemo agents. And so she had her first treatment in December of 2019, and some of the highlights I have listed here for her complete blood cell counts, right? Her white blood cells within the normal range, okay, at 4.82, red blood cells also within the normal range, but her MCV was high as well as her MCHC, and her platelets, again, even though within the normal range, still a bit high. So, of course, the pandemic hit, and you know, lots of stay-at-home orders, you know, a lockdown, and so really the follow-up tests were put on hold, and we were going by symptomology. She was doing well. However, she was on an antidepressant to begin with, an SSRI, okay, a selective serotonin reuptake inhibitor, escitalopram, which is Lexapro, and the guidelines for the administration of SAMe, of the S-adenosylmethionine, indicate it's still safe when you're up to a dose of about 10 milligrams of an SSRI, so we continued it. However, And for these first few months, she was still, negative for alopecia, and now completely, the nausea and vomiting had disappeared. However, most likely due to the COVID-19 restrictions, the lockdown, stay-at-home orders, her anxiety and depression increased. So her SSRI had to be increased from 10 to 20 milligrams. So we DC'd or discontinued the S-adenosylmethionine and went to our secondary, kind of as a proxy, the cobalamin, as cyanocobalamin, 1,000 micrograms, sublingually under the tongue daily. And this illustrates really one of the only main limitation to using the S-adenosylmethionine is in the case of the SSRIs. If the patient goes above a dose of 10 milligrams daily, then the SAMe has to be discontinued and another methylating agent used in its place. But however, she did well on the B12 also, on the cyanocobalamin. And finally, excuse me, with the easing of restrictions in her state, we were able to get some follow-up test results in April, late April of this year. And we see those here. Her white blood cell count was reduced. Her red blood cell count reduced also. MCV reduced, MCHC increased, and the platelet counts went down. So comparing, what we could, we saw the white blood cells decreased by 6%, just above statistically significant, but still, significant, and one of the indicators, right, for a good positive prognosis in CLL, in leukemia. Red blood cells, again, decreased only by 0.5%, right, 0.5%, not statistically significant, excuse me. Her MCV decreased by 3%, again, not statistically significant, but it was normalized, She went back into the normal range along with her MCHC, increased by, it wasn't that low to begin with, but it was increased back into the normal range. And the big decrease, the really significant decrease, came with the reduction in platelets. And again, usually that, along with the white blood cell count, the WBC, is really some of the key clinical indicators for improvement, And so here we see a 28% decrease in platelets. And this reduction in platelets also reduces not only her risk, but any patient's risk for clotting, right? Blood clotting due to thromboses and emboli. And as we saw kind of early on in the pandemic, that it was also a risk factor in sedentary patients, right, who were suffering from COVID-19. They may recover from the virus, but then we started seeing this blood clotting. So again, possible trials may be warranted for looking at methylating agents, right, as antivirals, and also to help, possibly reduce the blood clotting seen as well. And as I mentioned, we saw normalization of the other pertinent lab values. So overall, we feel we achieved the results, that we were looking for in our case study. We had attenuation of the post-chemo side effects, right, where there was, she was fully negative for alopecia, had minimal nausea and vomiting. The protocol itself, she tolerated very well. So we actually feel that, the limited, goals of our case study here, that looking for improved outcomes, was indeed met. So the protocol, as I said, would be the first line, if your first choice would be the S-adenosylmethionine, the SAMe at 400 milligrams by mouth daily. And again, discontinue if the patient is taking an SSRI, and a lot of cancer patients, as I'm sure we're all aware, do suffer from anxiety and depression, and a lot of times are on low-dose antidepressants, right, such as SSRIs. However, if their SSRI exceeds 10 milligrams, if they do end up bumping it up to 20 milligrams, then we can switch, okay, to our second line, the cobalamin. And usually, this is available over the counter as cyanocobalamin, 1,000 micrograms, can be taken either sublingually under the tongue, right, can be taken by mouth orally. And our third line, okay, the tertiary methylating agent, folic acid, okay, or folate, usually in a higher dose, right, than the average daily dose, 800 to 1,000 micrograms by mouth daily. I tend not to go with this as a recommendation, more so because of its effects in the growth of tumor cells in certain cancers. And as I said, in anti-folate therapies, right, chemotherapies, oftentimes it's used as a rescue medication, right? They'll be given, a week of chemo, take a week off, be given folic acid, and then resume chemo, just for the fact that the anti-folate is destroying the folic acid present in the healthy cells as well. But like I said, I tend to go with the first line of the S-adenosine methionine, because that really is nature's kind of go-to molecule for methylation. Okay, it is the primary methylator in living organisms. So, as I said, not a whole lot to present, but I do, want to give, special thanks and acknowledgments to, my team that I work with at Blue Ridge Community Technical College. We also are in collaboration, on some of our work with a team at Michigan State University, Dr. Zachary Burton and his team up there. Occasional input from Dr. Jose Marco at the University of Mexico in Mexico City, and also Shenandoah Oncology, all right, here in good old Winchester, Virginia, part of Valley Health System, okay, for their cooperation with this. And you all as well, okay, for your time and attention and participation. List of my references. And again, any questions, please, feel free to email me. Again, I as well will be more than happy to address any questions that that may come up after this webinar, after these couple of days here. And otherwise, I thank you all very much. I would welcome any questions now if you have them.